Go.
Hello and welcome. My name is Kimberly Holder, and today I will be speaking about just a few of the benefits of medical marijuana, such as to treat stress, mood disorders, depression, autism, and cancer patients. A lot of people in America do not understand the benefits of using medical marijuana as a form of treatment. These people just see marijuana as a drug and not as a form of treatment for patients. These same people are the ones who say that marijuana will lead to other more dangerous drugs. The fact is that just isn't true. Marijuana is not a drug. It is not man-made like other drugs such as cocaine and meth. Most people do not realize that one of the most important uses of cannabis is a substitute for other more dangerous or costly pharmaceutical drugs. We as Americans do not have the money to spend on numerous amounts of prescription medication, especially when cannabis is the solution to the problem. Most people would be shocked to know that there are over 100 million people in America smoking marijuana illegally for medical purposes. Medical marijuana can be a huge stress reliever. It can also be used as a treatment for patients with mood disorders. Stress reduction is a universal benefit of cannabis use, and scientific research supports the use of cannabis in stress reduction therapies. Relaxation and stress relief are the most commonly perceived benefits of cannabis use. Cannabis has been used in some patients for anxiety and bipolar disorder. Patients with cannabis for anxiety, depression have found that the mood-altering effects of cannabis is helpful in treating the anxiousness sometimes associated with depression. Cannabis can also help in aiding the insomnia sometimes present in depression and can improve appetite. Better pain control with cannabis can reduce chronic pain-related depression, and it may also help improve the mood of depressed patients under the guidance of a therapist. Cannabis has also been used in some patients with bipolar disorder. Numerous patients report significant improvement and stabilization with bipolar disorder when they use both medical marijuana and therapy as a form of treatment. Bipolar disorders vary tremendously in the time spent in the depressive versus manic states. Most bipolar patients trying cannabis find their cycles less often and find less significant improvement in their overall mood. Bipolar patients that respond well with the use of cannabis report that marijuana not only diminishes their undesirable moods, but also motivates them to productivity. Cannabis has other uses as well. Some have seen improvement in autism when one form of treatment is medical marijuana. The disability autism is one that doctors still don't know too much about. No one is able to say for sure how a child comes down with autism, whether it's genetics, immunizations, or just environmental factors. We do know, however, that autism can cause a child to have an unwillingness to eat and become very aggressive at some stages of autism. Miko Hester Perez is a mother of Valley, California, tried medical marijuana to treat her 10-year-old autistic son. She first did her research and found a doctor who had a protocol for using medical marijuana in autistic patients. She decided medical marijuana might be her son's last hope. At the age of only 10, he weighed 46 pounds due to his unwillingness to eat. She told Good Morning America, "You can see the bones in his chest. He was going to die." Her son also had aggression problems. She stated, "My son had self-injury behaviors, and he was a danger to himself and to others." She treated her son with medical marijuana in the form of a pot brownie. After just a few hours, she said you could see a change in both his appetite and demeanor. After just the first 2 hours, he was requesting food. That's when she knew she had made the right decision. She added that her son used to take a cocktail of medications 3 times every day for his condition. He now takes only 3 medications and has one marijuana brownie once every 2 or 3 days. She told Good Morning America, "I saved my son's life, and marijuana saved my son's life." Now, not only can cannabis be used for stress relief, depression, bipolar disorder, and autism, but it has also been proven to be helpful in treating cancer patients. Loss of appetite is common among cancer patients and can lead to weight loss and even anorexia. Researchers in Canada ran a small pilot study from May 2006 to December 2008 in 21 adult patients with any advanced cancer who had been eating less as a result of their illness for 2 weeks or more. All patients participating in this pilot were either undergoing chemotherapy or had in the past. At the end of the study, researchers found that 73% of THC-treated patients reported an increase in overall appreciation for food, and even the 27% that didn't show a decrease in appetite Cancer patients treated with cannabis also reported a better quality of sleep and relaxation. Patients are often given medications for long periods of time and do not get the rest they need for their bodies to be equipped for the medications they are receiving. Medical cannabis can both help eliminate some of the timely medication and also provide sleep and relaxation to those who really need to get their rest. Most cancer patients receiving medical marijuana as a form of treatment are often said to be in better moods and have better social lives than those who don't. Medical marijuana obviously has a lot of benefits, but how do we make it possible for patients to receive the proper medication? For medical marijuana to exist, we must all do what we can to make it happen. The use of medical marijuana in patients is already being used in states like California and Colorado. We need the same to be possible for all Americans, regardless of the state they live in. The legalization of medical marijuana would not only provide medication to those in need, but it would also boost the economy to where it should be. Medical marijuana would be sold like other prescription drugs in a pharmacy. These people would either have their insurance provider pay, or they would have to pay to get the prescription just like any other medication. Or it could be legalized and heavily regulated and taxed like cigarettes and alcohol with an age limit. Legalizing marijuana would also open up thousands of new jobs, dropping the unemployment rate tremendously. So what do we get from all of this? Medical marijuana should be legalized in all states, and it should be given to patients who really need it to treat stress, mood disorders, autism, cancer, and many others not mentioned. To help make this happen, we need for the Supreme Court to put it to a vote. They have recently denied legalizing marijuana in Georgia, saying it has no real medical benefits. We need to prove just how many medical benefits marijuana does have. In the next few years, when the topic is brought to the Supreme Court again, we need to do what we can to make this happen, whether it's protest, petition, whatever, and if it is ever put to a vote by the people, everyone needs to vote yes. Make medical marijuana legal for those in need. If we do this, more patients will be receiving the right form of medication and won't have to take as much of other medications. If we don't vote correctly, these same patients could die. Please do your part to help make it possible for patients to receive the medicine they really need.